This is Life Talk with Muriel Desar. Talk 100.3.
11:05 on the clock. A very, very good morning to you. My name is Muriel. I'm here to keep you company all the way until 3 o'clock. And bahar ka kya taapman hai? It's at about 26. Really? It's 26 degrees Celsius. Humidity at 42%. Winds blowing at 10 kilometers per hour. But today we thought, what do we do different? Let's start the show with information that matters. And that is why I have Dr. Amanjot Kaur Arora, specialist dermatologist, NMC Royal Medical Center, Khaimah. First things first, doctor, welcome to the show and thank you for having such a long drive and coming to the studio.
Thank you so much for having me, Muriel.
So how was your drive?
It was long, but then I had a pleasant time listening to your previous show when I was coming all the way to Dubai.
So did we scare you a bit because you look a little nervous?
Yeah. I mean, of course, this is your everyday job, not mine, right?
Interesting. Well, okay, we're talking about hair fall and we're talking about skincare routine, and you're a dermatologist. You would be, you wouldn't be, bowled over with the questions that I ask you, but hair fall is a massive, massive problem for most of us in the region. Either women or men or even children are going through it as well.
True.
Could you please sum it up for us and tell us why exactly are we losing so much hair?
No, true. I mean, a lot of times in my daily practice, I come across patients when they tell me, I just moved to UAE 5 to 6 months ago, or even 2-3 months ago, and I'm suffering from massive hair fall. And then I tell them, welcome to UAE. That's the beauty.
That's how you welcome people to the UAE?
Because this is what everybody goes through, and you just have to mold your way and diet and lifestyle around it so that you don't end up suffering from same.
So, but what are the problems? Like, the main reason for hair loss, I know people say it's the water. If you add a filter to it, it would kind of, purify the water for you. But I don't think it's just the water. It's got to do a lot more with the lifestyle, right?
Yeah, I mean, yes. See, the most common type of hair fall is called telogen effluvium, as we call it, which usually happens because of either some kind of physical stress or mental stress. So sometimes when you're moving to a country, there's so much going on, you're not taking proper care of yourself or your diet, and then improper nutrition. And with this recent trend of, losing weight by drugs like Mounjaro or Ozempic, which really give you that feeling of satiety. So you're not eating and you end up depriving your body from nutrition. And 2 to 3 months later, you would come and say that I'm suffering from this massive hair fall, yeah? So diet, lifestyle, stress play major culprits. Along with that, yes, water here in UAE is majorly desalinated water, which is high in minerals and salt. We call it hard water like that, right? So that leads to buildup on the scalp. It makes the hair feel dry, rough, brittle, prone to breakage, which may be perceived also as increased hair shedding. So yes, the quality of water does make an impact by making your hair rough and brittle. But the factors that I mentioned before also add to it, which leads to hair fall.
Well, we are going to delve right straight into this conversation, but in just a bit from now, I am in conversation with Dr. Amanjot Kaur Arora, specialist dermatologist, NMC Royal Medical Center, Khaimah. And if you have a question or two for her, make sure that you send them in on 0586861003, or maybe you can even give us a call, 800-81003.
Life Talk 100.3.
11:15 on the clock. A very, very good morning to you. My name is Muriel and the show is called Life Talk. We are with Dr. Amanjot Kaur Arora, specialist dermatologist at NMC Royal Medical Center, Khaimah. And she is in our studios, very kind enough to kind of grace our studios. Welcome to the show, Doctor.
Thank you. Thank you.
As you were speaking, we got a question that is come in from, the name is not written, but 409 at the ending digits. I have a question for Dr. Arora. My wife has suddenly developed bald patches on her head. She's 48 and healthy otherwise.
I think we should first ask the husband, or what stress is he giving his wife really? Is it something it has to do with him?
No, poor guy. Don't do this to him, doctor. Come on, tell us. What can she do?
I mean, since he says that there have been sudden development of bald patches, it looks like something we call alopecia areata. Now, this is something where your body suddenly starts reacting against your own body. So we have an autoimmune thing called autoimmunity, where your own immune system starts working against your own hair, and then when the antibodies get deposited on your scalp, they kill the hair and they shed off. Now, if it is progressing fast, we have to tell the immune system that relax, calm down, stop working against your own self. So what they need to do is see a dermatologist and get it sorted. It might need some medications get it sorted. It might need some medications to apply on the patches, but if the lesions are spreading really fast, then we might have to give some oral medication to calm down the immune system.
Well, there you go. Hoping that the answer, has worked for you. But also, doctor, there are so many other questions that are coming in now. Are there any lifestyle changes I can make to improve my hair and health? This has come in from Pooja.
See, of course, we always say in dermatology that you look like what you eat. And beauty and hair come from inside out. You cannot put things from outside and expect them to look good when you're not taking proper rest, taking care of your diet and lifestyle. So in my practice, I always ask patients to follow proper diet and lifestyle modifications to suit their skin needs. Now, hair, for example, is an accessory for the body. It's a cosmetic. So if you're not eating enough, hair would actually be the last thing to get the nutrition. So I always tell patients to take good amount of protein in diet. So we need 1 gram per kg of body weight of protein. So if you're 60 kilos, you need 60 grams of protein. And if you're 70 kilos, you need 70 grams of protein.
This is spread across the day?
This is spread across the day, yeah.
Okay.
And even if you're a vegetarian, you can still manage to take that amount of protein. So you don't tell me that I'm a vegetarian. That is talk for another day. But you have to, because see, what is hair? Hair is keratin, and keratin is protein. So it's only when you'll have enough is when it'll reach your hair and make it shine and grow. So protein is very important, and 1 gram per kg of that. And then I always tell my patients to eat the Vibgyor. That is all the
What is
7
the Vibgyor?
colors of the rainbow every single day. So, make a chart, make a salad with freshly cut fruits and vegetables, put in some greens, and take it at least once a day to make sure that you're taking all the micronutrients that are needed for growth of hair. So we're talking about zinc, selenium, manganese, biotin. You can get it from diet. You really don't need to depend on supplements for that. So protein and the Vibgyor every day is a must if you want to have good skin and hair. Now, rest again is very underrated, I think, in this days and age hustle. And we have people talking about 120 hours of working hours per
70
week.
hours to 120 hours, doctor.
So people don't get to take proper rest. And when you're stressed and your head muscles are all contracted, there is not good blood supply going to the hair to let it grow. So proper stress management, proper rest. Yes, I know it's difficult, but try to make yourself a priority.
Absolutely. We're also talking about rest. We're talking about lifestyle. Now, doctor, please educate me on this. When you mention all these parameters, is it possible that if I just have a protein shake, maybe I hit the gym, I require that excess for my body, will that work for me? Will that not work for me? Because that's protein, right? At the end of the day.
I usually say that, yes, if you work out, there's no harm at all. If you are taking, if your kidneys are working fine and if your physician is okay with that. But yes, I take a protein shake every day. I work out every day. But that gives you 25 grams of protein, right? Rest, 35 grams, I still have to take from diet, and I do try to take that.
So is my hair loss going to be permanent, or will it grow back? This one's coming in from Rajesh.
See, it depends upon the type of hair loss. Now, if you're suffering from something we call androgenetic alopecia, which is called male or female pattern hair loss. So in men, it is visible as receding hairline and loss of hair from the crown. And in women, it manifests as that the hairline is okay. It's same, but you start losing hair from the crown again. So there is this Christmas tree appearance that starts forming around your center partition. Now, this is the only type of hair loss which can be permanent, because here your hair are thinning out over a period of time under the influence of the hormones in your body. So they'll thin and disappear. And that is when only a hair transplant can help you out. But other types of hair fall which are happening because of physical stress, mental stress, illness, pregnancy, COVID, influenza, dengue, post these things, of course, once the stressor is gone and you work on your diet, take supplements, take lotions to apply, and if needed, take the help of certain procedures that we do in office, of course, we can reverse it.
You know, I have so many questions on my mind, Doctor, when it comes to the products that we use onto our hair. You know, everything that is expensive, does it mean that it's good? We will get to that question. But coming up next is an amazing track, और इसके बाद हम वापस आएंगे and we'll try and address all the questions that you have. Now, if you have another question for us, send them in on 0586861003.
InsuranceMarket.ae Live Talk 100.3.
11:27 on the clock. A very, very good morning to you. My name is Muriel, and today, you know, I am in chats with Dr. Amanjot Kaur Arora, specialist dermatologist, NMC Royal Medical Center, Russell Khaimah. You've got to download the NMC My Health app, and you can book appointments for you and your family members. Now, find the right doctor. It's very easy. Search for NMC specialist by location, expertise, and more. Manage your bookings. View your lab results conveniently within the app. Download the NMC My Health app today. Available for free on the App Store and Google Play as well. Booking an appointment has never been this easy, and we have Doctor in our studios. Doctor, you've been very kind enough in answering so many questions, but right now we have a question that is come in from Purva, and she says, "Hi, please, Doctor, could you explain how can a new mother deal with hair loss, also skin texture change postpartum, and is there a way to follow a better skin routine?"
Yes, of course. I mean, postpartum hair fall is a thing, and it should not be neglected. I mean, you have to realize that your body gave birth to a whole new being. And it may not sound nice, but I always tell mothers that babies are like parasites. They're going to take whatever they want from you to be self-sufficient, but that may end up depriving your body from the nutrition that your body needs, because the baby is going to take out what he wants, right? So a lot of moms postpartum forget to take care of themselves. Of course, we can understand it is overwhelming. I have a 1-year-old. I have been through it recently. So of course, your whole lifestyle goes for a toss, and it is difficult to kind of take care of yourself. But what I always tell every new mother is that don't skip your supplements. Even if you decide not to breastfeed, still 6 months after your delivery, take your supplements. And until you are breastfeeding, take your supplements religiously. So we are talking about iron, calcium, vitamin D, omega-3s every single day if you want your skin and hair to look great or still cope up after childbirth, because there's something called postpartum telogen effluvium or postpartum hair fall, which usually starts around 3 to 4 months after your delivery. Like they say na, jab bacha coo karne lag jata hai to maa ke baal jhadne lag jate hain.
Is it true?
Because
and I almost waited. I said, please don't make that cool sound or my hair will fall.
Yeah, because, you know, after any stress that your body goes through, you know, it takes 2 to 3 months for the hair fall to start. And by that time, you've already forgotten about the stress. But that is how it works. So, of course, in addition to supplement, as we talked about before, make protein an important part of your diet. Just be more mindful of what you're eating. Sirf pet bharne ke liye khana nahi khao. Eat with a specific agenda. Most of the days, at least 5 out of 7 days, be mindful of what you're eating. And then see a dermatologist. There are a lot of breastfeeding safe supplements to apply, to eat, that you can use to help with your hair fall. And as far as skincare routine is concerned, I mean, at this time where you are really busy, not just taking care of yourself, but a whole being is dependent on you, we try to keep things simple. So just one antioxidant kind of a serum that suits your skin, whether it's vitamin C, whether it's azelaic acid, one thing in the morning, After that, you put your moisturizer and sunscreen. And at bedtime, we look for something that will help to renew your skin overnight while you're sleeping. So up till 6 months of after delivery, I don't give retinoids, but after that I do to apply twice a week. Before that, you can use something like an AHA, 5 to 10%. Start with 2 nights a week to help your skin renew. So keep it simple. No
So tell
need
me
to have an
something.
elaborate skincare routine.
Right. So now tell me something, doctor. Once the aging starts, the skin starts aging, is there a way that you can reverse it?
Yes, of course. So when it comes to, let's say, the term which I again don't like, anti-aging, I think it should be more about pro-aging, but gracefully. There is no right or wrong. It depends on you, what you choose to do, and how you want to look. But yes, we can slow down the clock. We are aging from the day we are born, but we can slow down and look like the way that we want to. And the technology has made so much of progress that
Right.
perhaps 10 years ago we only talked about Botox and progress, that
Right.
perhaps 10 years ago we only talked about Botox and fillers. But now we've got so much more to do. We've got collagen biostimulants. We have non-invasive machines, which by the technique of ultrasound, something that's really safe, we do it even in pregnancy on our tummies,
Correct.
can be used to reverse the clock, to lift up the sag, and help you age more gracefully, if I can say.
Well, I have another question. We've been coming closer. We're inching closer towards our time. But doctor, I have to ask you this, right? With the kind of products that we put, and there are so many on display, you get to the hypermarket and it's like you're in a sea of all of them. And you're thinking, matlab, jitna mehenga hai, will be very good. The quality of that will be very good. Is
True.
it true?
Of course, I mean, I stick to one thing which we learnt in our schools, that all that glitters is not gold. So anything that
I
everything.
just got myself a shampoo yesterday and I was like, all that glitters is not
No,
gold.
for example, shampoo. For example, shampoo stays on your scalp for what? A minute? Maximum 2 minutes. Now, something that's on your scalp for 1 minute, how can it magically make your hair grow? Right? So, shampoos is the last thing I prescribe when I'm talking about hair fall, number one. Number two, when we were talking about the more expensive, the better, that's absolutely incorrect.
Why?
Because, a lot of times the product is marketed or priced at 10 times the cost of the consumable, just because of the marketing they have done, just about the money they've put in to build their brand. But wohi cheese, you can get the same thing you can get at a much cheaper price. I mean, the pharmacy grade products sometimes work much better than those elaborate serums that you see at Sephora or other expensive shops. So, and I know as a consumer, it can get really confusing and overwhelming. Social media is bombarded with options. Everybody wants glass skin. Everybody is a skincare expert. They talk to you in a way that the moment you've watched that reel, you want to go check out that product online and order it for you. But I think you will definitely end up a lot of money if, rather than listening to these people, if you are concerned about your skin, go to a right, trusted dermatologist who will see you for what you are, see what your issue is, see how your body is, how's your hemoglobin, how's your thyroid, how's your vitamin D.
So all of this is taken into account, and
of course, and then give you a customized skincare routine, something that will work for you.
Oh, wow. Okay, so basically my knowledge of this was, you put us under the scanner, which usually I have seen people do. They run the scanner on your face and then they tell you whether it's a yes, whether it's a no. But
Beauty
you're-
always works from inside out.
That's amazing. Well, this is some, important information that is being belted out right here. But I have also another thing to ask you, doctor. Since you are talking about over-the-counter products, right?
Mm-hmm.
Is it possible, rather, that we could go, say, to a pharmacy and look out for a particular product that would work, come May what? Would you recommend or no? It's a personal.
I cannot. Why? Because every skin is different. Every skin is of a different color. It has different thickness, different texture. One thing that works for everyone is a sunscreen. But again, there's so many different types. Something that is good for a dry skin, the one with oily skin may find it's too sticky. But sunscreen, yes, works for everybody, whether it's a physical mineral sunscreen that works even for sensitive skin. So yeah, that is something. But again, it's very difficult to generalize because all of us are so unique in our needs and our skin types. So there's not one product that I can say go buy it and it will definitely suit you.
Now, let's put the entire conversation that we've had together and ask you this question. Moving forward, are there treatments? Are there options? I mean, do I have to live with whatever I'm going through, or, your industry has kind of revolved and evolved into a whole new being?
Of course, there's so much that's come up in the last 10 years, or rather last 5 years in the beauty industry, that there is something to cater to everybody's needs and tastes. So if in an OPD, a patient comes and tells me, Doc, I'm no Botox, no fillers, I still have lots and lots of options to offer to them. And that would probably make you look even better than if you had Botox and filler. So there's lots of evolution that's that's happened in terms of procedures. And also skincare has evolved a lot. I mean, now we are talking at managing aging at DNA level with just creams. I mean, there's a great German brand here in our country called Eucerin, and they have got this serum called Epicillin, which literally reverses the clock by working on the DNA damage that happens on exposure to sunlight.
Wow.
So even with skincare, we're not just talking about fair and lovely and looking fairer or lovelier. I don't know if it really happened to anybody. But these days, skincare
It was a norm back in the days. Believe you me, every
all of us
household
have put
had
it in
that.
college
We
days.
all had it. I don't know whether it worked, but
Yeah.
definitely we had it.
Yes, and so now we are talking about skincare that works on DNA level as well. So you don't have to live with what you have. If you're not happy with it, there's lots of things in skincare. There's lots of procedures. I don't want to sound overwhelming. I might be at
But
the
there
moment.
are options.
There are.
So there is an option. If you have a worry, all you have to do.
According to your need, according to your taste, there's lots to offer.
Yes, only marriage doesn't, but this for certainly does. Well, thank you very much, Dr. Amanjot Kaur Arora, Specialist Dermatologist, NMC Royal Medical Center, Russell Khaimah. You've been very kind, gracing my studios
Thank
and
you.
also
It was
taking
an
us through.
absolute pleasure to be here.
Well, we'll continue more conversations. I have a surprise planned for you. Now, when will I open that little kitty and tell you about that? I will tell you. Nia, actually, I'll be with Aditya. Very, very soon, we are going to be joined by Baman Irani, but it's going to be a little while till we get in conversation with him. Until now, you enjoy this one. I'll be back. My name is Muriel. And, Doctor, just in case you want people to reach you out, how do you want them to reach you out on?
I mean, you can follow me on Instagram, where I frequently talk about skin and hair care. My handle is dr.amanjot_MD. And if you want to book appointments, use the NMC app or visit me at NMC Royal Medical Center, Russell Khaimah.
Absolutely, you got that. And if you want to not visit me, but if you want to see me, then you can get online. Muriel Talk 100.3. That's the ID for you to get on.